Imagine waking up every day with unbearable nerve pain, unable to find relief. The usual medications, gabapentin, Lyrica, tramadol, offer a temporary fix, but at a high cost, dependency, escalating doses, and a host of side effects. But what if there was a better way? In today's video, I'll introduce you to a game-changing natural solution that bypasses the pitfalls and dangers of conventional drugs. You'll discover how essential oils can safely and effectively diminish your pain. We'll also explore the science behind these powerful oils to help you reclaim your life. You won't want to miss this. Coming up. Hey there, health warriors, Dr. M here. If you're ready to conquer your peripheral neuropathy and start living again, then subscribe to our channel and don't forget to click on the bell to get notified as soon as we publish new content. Now let's dive in. The most prescribed drugs for neuropathy symptoms include gabapentin, Lyrica, Cymbalta, amitriptyline, and nortriptyline, and in some cases even tramadol, an opioid narcotic. All of these drugs come with a long list of side effects, and pharmaceutical companies don't even try to hide this information. Take a look at a clip from this commercial.
Nerve damage from diabetes causes diabetic nerve pain. Lyrica is FDA approved to treat this pain. Lyrica may cause serious allergic reactions or suicidal thoughts or actions. Tell your doctor right away if you have these new or worsening depression or unusual changes in mood or behavior, or swelling, trouble breathing, rash, hives, blisters, muscle pain with fever, tired feeling, or blurry vision. Common side effects are dizziness, sleepiness, weight gain, and swelling of hands, legs, and feet. Don't drink alcohol while taking Lyrica. Don't drive or use machinery until you know how Lyrica affects you. Those who have had a drug or alcohol problem may be more likely to misuse Lyrica.
Now I have less diabetic nerve pain.
The reality is that Lyrica isn't the only peripheral neuropathy drug with this long list of side effects. They all come with a huge list and the risk of dependency. So it's imperative for you to have a much safer alternative to deal with your neuropathy symptoms while your nerves undergo repair. Did you know that essential oils have been used for centuries for many therapeutic benefits, including pain relief? And this is now being validated by scientific research. Today, I'll cover 5 essential oils that have been shown in clinical studies to effectively alleviate and manage nerve pain, as well as other types of pain. Let's start with peppermint essential oil. Studies have shown that peppermint oil possesses analgesic and anti-inflammatory properties, making it an excellent source for reducing inflammation and calming nerve pain. Research suggests that when applied topically, menthol, the active compound in peppermint oil, interacts with the body in several ways to alleviate nerve pain. First, its cooling sensation on the surface of the skin stimulates the nerve cell endings that initiate pain. And then it desensitizes them by activating a protein called TRPM8. This protein distracts the brain from acknowledging the pain signals. This is known as the gate control theory of pain. Secondly, menthol acts as a vasodilator, widening blood vessels in the area of the damaged nerves to increase blood flow. This brings more oxygen and nutrients to the damaged nerves, promoting healing and reducing pain. A study published in the Journal of Clinical and Diagnostic Research in 2016 found that the application of topical menthol significantly reduced neuropathic pain in patients with diabetic neuropathy. Next, let's look at Wintergreen essential oil. Research shows that wintergreen oil contains anywhere between 85% and 99% methyl salicylate, a powerful anti-inflammatory agent. It reduces inflammation by inhibiting pro-inflammatory compounds known as prostaglandins, which decrease nerve pain. It also improves blood flow and circulation to the injured nerves. Due to its high concentration of methyl salicylate, wintergreen oil also has the capacity to distract the brain from deeper pain signals, temporarily relieving nerve pain. This is why clinical studies have identified it as a potent natural analgesic or pain reducer. Now, let's look at the amazing benefits of helichrysum oil. Helichrysum oil has several properties, making it a potent natural remedy for nerve pain. It contains anti-inflammatory, analgesic, antioxidant, and regenerative properties, making it effective in alleviating nerve pain. Certain compounds in this oil reduce the production of pro-inflammatory cytokines and pro-inflammatory prostaglandins like COX and LOX enzymes, which can induce and exacerbate pain signals. Helichrysum's rich antioxidant profile neutralizes free radicals and reduces oxidative stress to help alleviate nerve pain. This oil also reduces the amount of pain signals that reach the brain by interacting with pain receptors and neurotransmitters in the nervous system. The result is a significant reduction in the intensity of nerve pain. Okay, get ready for a side note, gang, because this next property is what makes helichrysum oil truly amazing. Studies have shown that it promotes tissue repair and nerve regeneration. Compounds such as nerol and other terpenoids found in helichrysum oil have neuroprotective effects in both the central and peripheral nervous system. In fact, studies have found that terpenoids restore blood-brain barrier permeability, protecting the brain from neurological disorders. Research has shown that a specific terpenoid, nerol, promotes the survival and function of the nerve cells while protecting the cell membrane integrity and supporting mitochondrial function. Some studies even suggest that nerol may stimulate neurogenesis, which is new nerve growth. Now, that's exciting. Okay, on to the power of marjoram. Marjoram essential oil contains several bioactive compounds that support nerve cell repair and regeneration. Key compounds in this oil are terpenes, phenols, esters, and cineol. These compounds have strong anti-inflammatory effects that help reduce neuroinflammation, a major cause of nerve damage. The compounds also have strong antioxidant properties to neutralize free radicals and protect nerves from oxidative stress, as well as other toxins that can lead to neuronal damage. Most importantly for neuropathy sufferers, marjoram essential oil can decrease nerve pain intensity by desensitizing pain receptors in both the peripheral and the central nervous systems. It also stimulates the release of brain neurotransmitters like serotonin, endorphins, and noradrenaline, which play crucial roles in decreasing pain perception. Last on our list is lavender essential oil. Lavender oil is one of the most well-known essential oils and also one of the most well-studied oils due to its analgesic and anti-inflammatory properties. Compounds in this oil like linalool and linaloyl acetate have strong analgesic properties which help to block nerve pain signals. Research has shown that the anti-inflammatory properties of lavender oil reduce neuroinflammation, resulting in decreased nerve pain and symptoms. A 2015 study found that applying diluted lavender essential oil topically can relieve pain equally as effective as the opioid medication tramadol with none of the side effects. Another study in 2012 found that inhaling lavender can reduce the severity of migraine headaches. Now, let's take a quick look at this study published just this year, 2024. It showed that the inhalation of lavender oil reduced the quality, severity, and intensity of post-herpetic neuralgia. This is the nerve pain that's left over after a shingles outbreak. This is a game changer, health warriors. Now, let me share with you a personal story. Last November, Dr. C had a shingles outbreak for the first time in his life. The pain was unbearable. Since he didn't want to take any drugs, he opted for applying our pain cream formula, Neuphoria Rapid Relief Cream, which contains many essential oils, including lavender oil. We knew it helped peripheral neuropathy symptoms, but we were amazed to see that it actually helped reduce his shingles pain. He had to apply it frequently, every hour, but it provided substantial relief, even though it didn't completely eliminate the pain. That experience reminded us of just how powerful essential oils are. If you want to learn more about how Dr. C managed his recovery and avoided long-term nerve pain from shingles, check out this video. I'll leave a link for you below. Now, here's another incredible finding about lavender oil. A clinical study revealed that this essential oil boosts GABA production in the brain. GABA will diminish abnormal nerve impulses and decrease nerve pain signals. Research has also shown that increased GABA can reduce neuroinflammation and nerve pain by decreasing cortisol levels. Besides this, lavender oil has been proven to improve sleep quality. Studies have found that inhaling lavender can promote deeper sleep cycles. So, for neuropathy sufferers who often lay awake due to the pain at night, just place a few drops of lavender into a diffuser and allow it to run while you sleep. Okay, so let's talk about how to use these oils for pain relief. Essential oils can be inhaled or applied topically. First, make sure you're using high-quality essential oils that are steam distilled or cold pressed. Never use an oil that's been extracted by a solvent because they use chemicals like hexane or petroleum ethers, which are toxic and carcinogenic. Health warriors, here's a critical side note. Don't be fooled into thinking that essential oils are chemical-free simply because they state they are pure, all-natural, or non-GMO. Companies can still use hexane as an extraction method, so make sure to check the website and look for the words steam distillation or cold pressed. Now, we always get asked what brands we recommend, and I'm happy to share that with you. We're not getting paid by any of these brands. They're simply the ones we've researched and personally used for ourselves. We recommend Purador, Vitacost, Cleganic, Rocky Mountain, and Young Living oils. All of these oils are available on Amazon. Here's another side note, gang. Always dilute an essential oil with the carrier oil. Essential oils can irritate the skin when applied directly. Carrier oils are used to dilute them and help them penetrate the skin. You can use almond oil, jojoba, coconut oil, or even argan oil as a carrier. Now, let's talk about the method of delivery. First, let's look at inhalation, the fastest absorption method into the body. When inhaled, essential oils are processed in a few ways. First, the olfactory receptors in the nose send direct signals to the forebrain by root of the olfactory nerve. The forebrain processes the signals from the essential oils to decrease pain and inflammation. Also, the mucous membranes in the nasal passageways and the lungs carry essential oil molecules directly into the bloodstream, giving the body the fastest route of absorption. There are two methods of inhalation therapy. One uses an ultrasonic diffuser, while the other uses a nebulizing diffuser. Here's the difference. Ultrasonic units, which are less expensive, use a mixture of water and essential oils. The unit creates vibrations that break the essential oils down and distributes them into the air. If you use this type of unit, make sure to use only distilled or filtered water and clean it regularly to prevent mold buildup. Now, nebulizing models, however, use only pure essential oil and pressurized air to distribute a more potent, undiluted oil into the air. If you're interested in learning more about these two types of diffusers, I came across a really good video on YouTube that breaks it down, and I'll include the link below for you. So, which one should you use? Well, if you have mild symptoms of neuropathy, you'll do just fine with a steam diffuser. However, if your symptoms are severe, I would invest in the nebulizer for a more powerful therapeutic effect. However, there is one drawback in my humble opinion. When dealing with peripheral neuropathy pain and symptoms, we found that combining a few of the essential oils we've talked about is far more effective for symptom control than using a single essential oil. So if you use a nebulizer unit, I recommend you get an empty essential oil bottle and combine your own oils. Now, this can get a bit tricky, so let me give you a sample recipe. So you would use a 15 ml essential oil bottle. I'll include a link for these bottles below. And in the bottle, you're going to mix 64 drops of peppermint oil, 44 drops of wintergreen oil, 40 drops of helichrysum oil, and 36 drops of lavender oil. You don't need any carrier oils whatsoever when using a nebulizer or a steam diffuser. For a steam diffuser, the ratio of oils are a bit different. For this type of unit, you'd want to use 2 ounces of distilled or filtered water, then add 10 drops of peppermint, 10 drops of helichrysum, 5 drops of wintergreen, and 4 drops of lavender oil. Okay, so this is just a rough estimate. You guys play around with it, see what feels better for you. Okay, gang, here comes another important side note. Diffused essential oils can be very dangerous for cats. Cats lack an enzyme in their liver that breaks down the essential oils. And since these oils can be rapidly absorbed by your cat, they can pose a dangerous toxic threat. Now, if you have cats like we do, that doesn't mean you can't use essential oils. When I use them in our house, I just make sure my beautiful felines are not in the room. It's also important to exercise caution around dogs as well. Unlike cats, a healthy dog can metabolize most essential oils, but certain ones are poisonous, like tea tree oil, wintergreen, peppermint, pennyroyal, cinnamon, citrus, and ylang-ylang oils. So gang, please exercise caution when using essential oils around your fur babies. By the way, you can safely and effectively use certain essential oils for your dogs. We do all the time to treat them holistically. If you're not familiar with the vet Dr. Karen Becker, you need to look her up. She puts out fantastic information on all things natural for your fur baby, from food to best medical approaches. I'll put a link below for her video on essential oils and your fur baby. Okay, now let's move on to how to apply these oils topically. Using many of these oils on our skin is often easier than inhaling them. For our patients, we usually recommend doing both inhalation and topical application. Remember, for application to your skin, you always have to dilute the essential oil in a carrier oil first. It doesn't matter which carrier oil you use. You can start with approximately 18 drops of essential oil per 1 ounce of carrier oil. Now, this isn't cast in stone, it's simply a guideline. You can adjust this to a stronger or weaker mix depending upon your tolerance. Always do a skin patch test first to make sure you don't have a reaction to the oils. So, here are a couple of recipes for nerve pain. Recipe number 1, take 1 ounce of your carrier oil and add 7 drops of peppermint, 6 drops of wintergreen, 3 drops of lavender, and 2 drops of helichrysum oil. Then you can apply this to your skin as often as necessary. Recipe number 2, take the same 1 ounce of carrier oil and mix it with 9 drops of helichrysum oil and 9 drops of marjoram oil. Using either of these recipes, you're going to rub them into the affected area as often as you need to. About 13 years ago, we realized that most people don't like having to mix the oils themselves, or they often don't like the oiliness when they apply it to their skin. They also usually don't like experimenting to see which oils give them the best relief. So after a long period of development, which is a euphemism to say after much trial and error, we were able to come up with the Neuphoria Rapid Relief Pain Cream. Since we deal with many seniors who, besides suffering from peripheral neuropathy, also battle arthritis pain and other joint and muscle pains, we wanted our formula to effectively battle nerve, muscle, and joint pain. So what we did was we used a combination of 6 different essential oils along with carrier oils known for their regenerative properties. We only use wild harvested and organic oils, and yes, they are steam distilled. Please realize you don't have to buy our formula. You can certainly make your own, which is why I provided you with a few different recipes. I share this information with you guys simply because there are always people who want to know what they can buy, but the choice is all yours. Battling neuropathy symptoms goes far beyond challenging. These symptoms can leave you debilitated and without hope. And when you look to pharmaceutical drugs for relief, you then have to contend with the many side effects they carry, along with the possibility of dependency or addiction. Often it feels like you're trading one obstacle for another. But in the midst of this daunting landscape, there is a ray of hope. You don't have to resort to risky medications. There are safer, natural alternatives that offer relief without the harsh consequences of medications. Essential oils are proven champions, offering an effective and gentle solution to reduce nerve pain and restore quality of life. From peppermint and wintergreen to helichrysum, marjoram, and lavender, these oils possess remarkable properties that soothe inflamed nerves, promote healing, alleviate pain, and even assist in regeneration. So, if you're tired of trading one obstacle for another, it's time to explore the holistic approach of essential oils and take back control of your life one drop at a time. Now, we have a small favor to ask you. It's our mission to help people globally conquer their neuropathy, and we need your help to do this. Please like this video and share it with anyone it might help. Don't forget to click on the bell to be notified as soon as we release new content each week. Until next time, my dear friends, I look forward to seeing you on the road to great nerve health. Blessings. There are two molecules. All right, did not do my tongue exercises today. But in the midst,